to engage in advanced care planning discussions and talk about their healthcare wishes and goals. Here to talk about the importance of this day is Dr. Ross Albert, Medical Director for Hospice and Palliative Care at Hartford Healthcare at Home. Thank you very much for joining us today.
Thanks for having me.
Tell us exactly what's going on.
So when we talk about National Healthcare Decision Day and advanced care planning is the opportunity for people to let the people know in their lives, let their physicians and providers know what their medical wishes are, what their goals are, so that to make those decisions in advance, so that if we reach a point where we're not able to speak for ourselves, if we reach this point where we are infirmed significantly, that the people around us can help us make decisions knowing those goals and wishes.
You know, and unfortunately, a lot of families are rather hesitant to talk about these issues. Why is it so important to talk about that right now?
Yeah, it's really important to talk in advance so that if those people need to make decisions for us, if we reach a point where we're not able to speak for ourselves, that the people who we're asking to do that have already had those conversations with us so that they're speaking really with our voice, that they're making our decisions. And that's obviously so important. Some of the toughest cases we've had to care for are people who are trying to make decisions for their loved ones who say, we've never had these discussions before. We don't know what they'd want. So talking ahead of time is really a gift and a way to help the people that you care about the most.
And are there any tools out there that can actually help families make decisions and talk about this particular issue?
There are some. Certainly talking with your doctor and your providers to get a sense of where your medical health is and talking through this. But also there's some other things out there in the community. There's a program, 5 Wishes, which we can get through the community, through some church groups as well, which is an opportunity to talk through and sort of prioritize what's most important to us in terms of our independence, our health, our caregiving. There's an online program called prepareforyourcare.com. Is another one that, again, we can go through with our families. You don't need your doctor to do it, and talk through what's important in your life. There's even a card game you can get called Go Wish. It's just, again, another opportunity, another icebreaker to have these conversations together with the people that are really important in your life.
And when it comes to healthcare wishes, who should we be talking to about those things?
Yeah, we should be working with our physician after we talk, or talking with our physician and those people most important to us. We should be ideally taking that information and creating what's called an advanced directive, which is a combination. It's a document that includes both a healthcare representative form and a living will. The healthcare representative form is the piece that says, if I can't speak for myself, this is the person who I want to speak for me. And then the living will is the portion that really talks about those individual choices around those heavy things like CPR, intubation, dialysis, things like that. Again, an opportunity for us to speak in advance to tell the people we love, this is what I would want or this is what I wouldn't want in case I get so sick that I can't speak for myself.
Definitely important information out there. Dr. Ross Albert, thank you very much for joining us.
Thank you very much.